Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's new with vaccination for the flu, COVID-19, and respiratory syncytial virus, RSV? Find out more right now. My guest this evening is Dr. Kisha Davis, Montgomery County's newest health officer. Kisha, welcome to Housecall.
Thank you so much for having me.
Our pleasure. So briefly tell our viewers first about your professional background.
Sure. Thanks again for having me. So I am a Montgomery County native, born and raised in the Quince Orchard area. So it's nice to be able to serve where I grew up. I'm a family physician. I started at a community health center outside of Baltimore, then did a White House fellowship. And then I joined a practice, helped to open a practice called Casey Health Institute that was in Gaithersburg. And we were integrated in that we really focused on team-based care and really serving the community from a primary care focus. After that practice closed, I joined a value-based care company called Aledade, and we had practices all over the country. But I really wanted to come back and practice in my backyard. And so working for the county health department really gives me the opportunity to impact the lives and health and wellness of my neighbors. So it's great to be working right here at home.
Terrific. So educate our viewers before we get to the topic at hand. What exactly does a health officer do in Montgomery County?
Sure. So the health officer works in conjunction with the health department and the state health department to really think about how we're promoting the health and wellness of all Montgomery County residents. The health department is comprised of 5 different service areas: public health, services to end and prevent homelessness, aging and disability, behavioral health, and the one that of course that I'm forgetting. And really, in my role as chief health officer is really working across the department, breaking down those silos. And so looking at how we can better integrate the thing that we are doing in children, youth, and families, that's the other department, with what we're doing in public health, with what we're doing in behavioral health. A lot of times the clients that we serve are the same. And so there's a role there in the health department in thinking about what's the health and wellness of the citizens of Montgomery County, but also thinking about how we're promoting health in all policies outside of just the health department. And so I get to work with the county executive and county council and other departments within the county government to think about what are those things that we should be doing that are promoting health. As a physician, I think, physicians have a lot to do with that, but sometimes putting another doctor's office on the corner is not the thing that's going to promote health in a community. Sometimes it might be putting a grocery store on that corner, or investing in education or transportation and housing. And so how we think about the interplay of all of those things in promoting the health is one of the fun things that I get to do, and doing it in a way that also helps to reduce health disparities.
Very good. Let's go on then to the topic at hand, which is vaccinations. Briefly tell our viewers, what exactly is a vaccine?
So a vaccination is a way to help boost your body's immune system so that when it sees an infection, it remembers it and helps your body to be better prepared to fight that infection later on. So when you're getting a vaccine, you're getting a little sample. Sometimes it could be a live vaccine where you're getting an actual little bit of that infection, or sometimes it's what we call dead or killed virus, where it doesn't contain any active pieces of that infecting agent. There's 2 important things to remember about vaccines and the importance of it. So one, it provides protection to yourself. So when you get a vaccination, when kids get vaccinated against measles, mumps, and rubella, the MMR vaccine, they are much less likely to get that infection later on. And so they don't have to suffer the consequences of having measles, mumps, or rubella as they get older. But there's another benefit that's even greater than that individual benefit, and that's something called herd immunity. And so when enough people in the community are vaccinated, that decreases the risk of that infection being able to spread throughout the community. And so we want individuals to get vaccinated to protect themselves, but also to protect those around us. And then when you do have that person, maybe that young infant that's under 6 months that can't get vaccinated, or maybe that person who's immunocompromised who can't get vaccinated, there still is some protection because there aren't a lot of places for that vaccine, for that infection to jump and spread throughout the community.
So it's both a personal as well as community-wide benefit.
Absolutely. Absolutely.
So some viewers are watching now and saying, oh, a vaccine is an antibiotic. What would you say to them?
Well, I would say that's different. So an antibiotic helps when you've been exposed, when it is treating an illness. So when you think about you've got pneumonia or a urine infection or a skin infection, that disease has already happened, and the antibiotic helps your body to fight that infection. Whereas a vaccination is really being proactive so that you don't ever have to get that infection in the first place. And so really it's helping to prevent your body from getting it. Now, some folks will say, hey, I got a vaccine and I still got X, Y, or Z illness. And with COVID and flu and other things, you'll hear that. What we do know is that for folks who have been vaccinated, they aren't 100%. Sometimes you still may get the infection, but oftentimes it is much less severe than it would have been had your body not already been primed to be able to fight that infection.
Let's start off then by discussing the flu. Some people dismiss the flu saying, oh, you get sick for a few days and you go back about your business. But we both know there's different parts of our population where that's not necessarily true. So share with our viewers some of the consequences of the flu.
Sure. One of the things that I would tell my patients when they push back on getting the flu shot and say, I'm young and healthy, it's not going to cause much problem for me. Say, maybe the flu, even in the young and healthy, will probably put you on your butt for a few days. Do you have the time off, and can you afford to be home from work for those days when you're sick? But we also know that influenza, the flu, causes lots of morbidity and mortality for our elderly folks, for our folks with chronic disease, and for young infants. And so again, it's that community benefit of having more folks vaccinated. Influenza causes quite a significant number of deaths. Before COVID, it was the #1 infectious disease killer of elderly folks. And so when we think about that impact that has for something that we can prevent, the same is true for our young infants, especially those under 6 months who aren't able to get the flu vaccine. We know that they can really suffer if they were to get the flu. And so providing that prevention makes a really big difference for those groups.
Tell our viewers, what are some of the numbers you hear about mortalities, maybe countywide, statewide, or even nationally?
Sure. So when we look at COVID, or I'm sorry, for the flu, I don't have the exact numbers, but it's in the hundreds of thousands of people who are hospitalized and tens of thousands of people who are killed each year from influenza. And so it is pretty significant in terms of impact that we see. In terms of the county numbers, I don't have the exact numbers on hand. But what is important to remember is that when we think about the flu vaccine and the number of folks that it kills each year, COVID is worse. And so I think in some ways people have gotten complacent about COVID. It seems to be more mild. When we looked last year at the number of people, we had about, I think, 50 to 100 people die across the entire state of Maryland from influenza. The numbers of people who died from COVID were 50 to 100 in just a month. And so the dramatic increase in the impact of COVID on folks, especially in terms of that mortality factor.
Circling back to the flu then, the flu shot is recommended once a year. Why is that? Why can't one flu shot be good for forever?
The flu, COVID is another one where we see variants. There are lots of mutations that happen in the flu shot, and it changes a little bit each year. The immunity, that protection that you get from the flu shot lasts about 6 months. And so we really try to get people to get their flu shot in that kind of September to March season. That's when we see peak flu season in the United States. One thing we think about is what's the efficacy of it? Is this flu a good match for the flu that's circulating now? And you'll hear some years are a really good match and some years aren't. This year, what we usually predict that on is what we're seeing in the Southern Hemisphere. So the Southern Hemisphere, South America, their flu season runs from about March to September. And the flu vaccine prevented about 50% of hospitalizations. And the flu that we are starting to see circulate now seems very similar to what we saw back then. And so we are expecting pretty good effectiveness of the flu vaccine that's being given out now. It's never 100%. That would be nice, but that's where we see those mutations that come in the flu each year causes that to happen. You don't see that with others. So there are some vaccines where you're one and done, right? MMR, you get it as a kid, you don't keep getting it. And that's part of that is just the nature of different viruses and different infectious disease and their kind of characteristics that cause some to mutate and we have to keep getting shots and others to be stable throughout a lifetime.
You consider getting the flu vaccine. Do you recommend the basic injection? Do you recommend the flu mist, the nasal spray? Or I understand there is a much higher dose for seniors.
So we do recommend that seniors get the higher dose. We think that, what the studies have shown is that because our seniors have a little bit lesser immunity, sometimes they don't mount the same immune response to the flu vaccine. And so that's why we recommend that they get the higher dose. I want to touch a little bit on that kind of immune response. So some folks say, I don't want to get the flu shot because I don't feel good after. I get a little achy, sometimes a headache, sometimes a fever. Part of that, you can't get the flu from the flu vaccine. But part of that is your body mounting an immune response. It's a sign that your body recognized that it got something and it's able to respond. And it's a good sign that if your body were to come in contact with the flu, it would know and recognize it and not react in that same way. There was flu mist for a while that was taken off the market, and now they're starting to bring back another nasal version of the flu. I think the public health community is excited about the potential for some new ways to administer the flu vaccine, because we know that not everybody likes a shot. And so if there's some other ways to be able to administer that, I think that would help to get more folks on board.
Terrific. We're going to pause briefly for a public service announcement. More with my guest, Dr. Kisha Davis, Montgomery County Health Officer, and we'll be discussing vaccinations for COVID-19 and RSV. We'll be right back.
We're all just trying to keep things running for those who rely on us. That's why we don't have time to be sick with the flu.
We don't have time for delays.
Ready!
We don't have time for spills.
Next.
We don't have time for setbacks. Let's be real.
Getting the flu shot
Helps you fight the flu.
Get a flu shot for yourself and those around you too.
I got my COVID-19 vaccination, and here's why. This isn't about gimmicks or sentiment or what commercial I like. This is about facts. COVID-19 vaccines are safe and effective. Millions of doses have already been given in the United States, and these vaccines have the most intensive safety monitoring in U.S. history. When you need more information, use a reliable source like the CDC website and get the facts.
We're back. My guest this evening is Dr. Kisha Davis, Montgomery County Health Officer, and we're discussing vaccinations for the flu, COVID-19, and RSV. Kisha, let's go on to discuss COVID-19, since our viewers are, of course, so concerned about that. Tell our viewers briefly, what is the update on COVID-19 vaccination?
So you may have heard that there's a new COVID vaccine that's available now. This is a monovalent vaccine, and it's been updated for the 2023-2024 respiratory virus season. So basically for this year. And this is the one that folks should get. So there are three brands that are available. So Pfizer, Moderna, and Novavax. The Pfizer and Moderna are mRNA vaccines. So that's a new way that we found to make vaccines since COVID. And then the Novavax vaccine is kind of your traditional antibody response vaccine that's out and available.
And is there any difference in their benefit or side effects?
So the benefit and side effects are similar. If folks have had a previous COVID vaccine, then you kind of know by now what that response will be. The efficacy is good. I think the thing that's reassuring right now, so we talked a little bit earlier about variants, and the thing that we've seen about COVID is that it likes to change. There are new variants that are popping up quite often. The vaccines that are out now for COVID, the Pfizer, Moderna, and the Novavax, are all targeting the Omicron chain, which is what the variants are that are out now. So that's a really good sign that they are going to be effective against the virus that is circulating in our midst at this time. The older vaccine, so if you got a previous COVID vaccine, you may say, but I've gotten the vaccine a lot of times before. Why do I need it to get it again? Those strains of COVID are not really circulating right now. And so that means you don't have that much protection, even if you've previously had the vaccine maybe 6 months or a year ago, or had COVID last year. The variant that's circulating now is different, and the vaccine has been updated to be able to be a better match for that.
What kind of side effects have been reported with the COVID-19 vaccines?
So the biggest thing we see, obviously, is some arm soreness at the site, maybe redness, maybe even a little lump or swelling where the injection site is. Some folks might get a low-grade fever or temperature, some achiness, headache, feeling a little bit just tired for the next day or so. I've had multiple COVID vaccines now, and I think I've had the full gamut. So I've had, personally, I've had the vaccine and had no effect, no arm soreness, no anything. I've had headaches, feeling a little achy, tired, and each one has been a little bit different.
If someone goes to their local pharmacy to get the COVID-19 vaccine, and let's say they had the previously Pfizer, and then they go to the pharmacy and they've run out of the Pfizer vaccine, but there is Moderna available, can they mix and match?
So when folks were getting their initial series of the COVID vaccine, when it first came out, it was recommended that you stick with whatever you started with. So if folks will remember, it was kind of a 2-dose series. And so if you got Pfizer first, then you should get Pfizer for your second shot. If you got Moderna first, you should stick with Moderna. At this point now, it really is okay to mix and match. And so if you got Pfizer before, it's okay to go to Moderna. Now we've kind of built up enough community immunity that's okay. Same thing with Novavax. If you got, one of the mRNA vaccinations before and you wanted to get Novavax this time, that's fine. I would encourage people to go with kind of what's available, and that's fine. The level of efficacy for each of these is well over 90%. And so there really isn't much difference in terms of one being better than the other.
You mentioned at the top of
and one thing I will say, folks may have heard about the Johnson and Johnson one that has not been updated. And so really we're encouraging folks to get the Pfizer, the Moderna, or the Novavax. The Johnson and Johnson one really isn't available anymore.
You mentioned at the top of the show the important concept of herd immunity. So how are things looking both in Montgomery County and nationally for the percentage of people who've been vaccinated to improve our overall herd immunity?
We could do a lot better. So one of the things that Montgomery County should be really proud about was that for the initial COVID vaccine, we had amazing numbers. We were leaders in the country in terms of COVID vaccination. For our seniors, we had almost 90% of our senior folks over 65 who had the COVID vaccination. And the other thing that was really important was that not only did we have really high vaccination rates, we did that with little to no disparity. So when you looked at our African American population, our Latinx population, our Asian populations, those numbers were very similar, which is rare to see. We are not doing as well now. When we look at our flu vaccination rates, they are at about 20%, and our COVID vaccination rates are probably less than 10% at this point for the county. And so we really are trying to get the word out. So I'm so thankful to be on the show tonight to talk about it. And I really want to stress for folks that now is the time to really be thinking about getting your flu vaccine, your fall vaccines, before we start going into the holiday season, Thanksgiving and the December holidays when folks are going to be traveling. Now, this week, the beginning of November, getting your shots now really gives good immunity through the end of the year when we're going to be in a lot of social settings. And so this is the time to help protect yourself and your community.
You mentioned earlier that some patients understandably are reluctant to get vaccinated because it involves an injection. I have heard efforts at the FDA and CDC to develop combination vaccinations with flu and COVID-19. Any progress there?
I am very hopeful that we've heard some information from the CDC that is coming. I think we were really hopeful that we would see that this year for this fall season. It didn't quite make it for this year, but I am cautiously optimistic that in 2024 we will start seeing some combination vaccines.
Okay, let's shift gears then to our third topic, respiratory syncytial virus, RSV. Tell our viewers, where did this virus come from? Many of them have never heard of RSV.
Yeah, it's surprising. RSV has been around for decades, and yet nobody was really talking about it. And that's because for most folks, it causes a pretty mild illness, probably in most cases chalked up to the common cold. The ones who it really causes severe illness for are young babies, especially those who are preterm or low birth weight, our seniors, and those with extensive chronic disease. Part of what we saw last year, because folks have been masked for the last few years, we started to see this resurgence last year of common cold and things that people's bodies just hadn't been exposed to for the last few years because we were inside our homes and being masked. And so people started getting sick again. And one of those things was with RSV. But we know that really in our babies, so RSV is responsible for a lot of deaths in babies and for our seniors. And so it was a good time to kind of bring attention to that. And we saw the waves of RSV and flu and COVID last year. We expect this year will probably be a milder RSV season than last year, but probably not as mild as what we've seen in the past. Another thing to remember is we now have kind of 3 winter viruses that we're contending with. In the past, there was only 2. So even with a mild COVID winter, you still have that on top of flu and RSV. And so you're adding a third thing to what used to just be 2.
Tell our viewers what is entailed with an RSV vaccination.
So again, it's an injection and there are 3 primary groups who are eligible for this. So the first is our adults over 60. As of right now, it's a one-time injection. So we'll have a lot of folks who get it this year, and then they may not need to continue getting it. The second group is for pregnant persons between 32 and 36 weeks that are set to deliver in the kind of fall RSV season. And so giving that vaccination to mom has twofold effect. One, it gives her some immunity. So if she were to catch RSV after she delivers, she's less likely to give it to the baby. It also gives some protection, some antibody protection to that infant once it's delivered. And then the third, you'll often hear it referred to as an RSV vaccine for babies, but actually it's it's RSV antibodies that were given. So the immune response that happens when you give a vaccine is that your body builds up what we call antibodies. That's how your body recognizes it and fights the infection. For infants, we're actually giving them those RSV antibodies. They're too little for their body to really mount that immune response. And so by giving them the antibodies, you're giving them the tool to be able to fight that infection. And so we give that to newborns who are low birth weight or preterm who are born in that kind of RSV season.
And just to be clear for our viewers, if you're a senior, it's a one-time vaccination. It's not year after year.
As of right now, correct. It's one time.
What are the side effects of the vaccine?
Similar to flu and COVID. So some arm soreness is the main thing. Also some fatigue. One thing we do see sometimes with any vaccine, sometimes you see people who faint or react, but we see that maybe a little bit more in our pregnant women who are getting that vaccine just because of, blood pressure shifts and being lightheaded. Pregnant women are a little bit more prone to fainting just in general. And so those are the kind of major side effects that we're seeing. It's the same sort of feeling maybe a little bit achy, a little bit tired.
Sure. Well, this has been a wonderful interview. You provided a lot of meaningful information for the general public. If any viewer has any questions, how can they reach you?
Certainly. Happy to take emails. You can reach out to me at kisha.davis@montgomerycountymd.gov. That's KISHA.DAVIS@montgomerycountymd.gov.
Thank you so much for joining us at House Call this evening.
Thank you so much for having me. It was a pleasure.
My thanks to Dr. Davis for a very informative, important interview. My thanks to the team at the studio for making this show happen. And finally, my thanks to you, the viewer, for joining us this evening. Tell us how we're doing. You can reach me on the website listed below. As for our next show, it's going to be Dr. Angela Marshall, president of the Montgomery County Medical Society, and she'll be discussing countywide and statewide health issues to be addressed in the upcoming legislative session in Annapolis. It's going to be an important show. See you then next time on House Call. We're now 10 years on the air and still going strong. See you then next time. Good evening.